Furman, 1 year ago today, we spoke with Covenant Health about how COVID-19 was impacting their staff.
They were dealing with a lack of enough staff to treat patients, and that meant nurses and doctors were quite overwhelmed, especially in the ICUs. So 3 vaccines and 12 months later, how much better are things there? KLBK's Elizabeth Fitz finds out.
1 year ago, CEO of Covenant Medical Center Chris Lancaster talked about a need for more nurses, a staffing shortage that showed no signs of improvement.
I think we were in a nursing shortage before we got into the pandemic, and so you just kind of see it magnified during this time.
Today, numbers continue to fluctuate.
But that kind of great resignation, as it's being called across other industries, is happening in healthcare too, and in a lot of ways even more so. And so we still have many of the same challenges that we had a year ago, unfortunately.
Job openings are up 5 to 15% compared with pre-pandemic numbers.
We've been able to do some things like you've seen other hospitals do, which is your typical recruitment efforts, referral bonuses, sign-on bonuses, things like that. At the end of the day, though, those aren't sustainable, and that's not what keeps folks around.
What keeps folks around, Lancaster says, is the culture.
Folks get into this to make a difference in other people's lives, and that's what's special about healthcare, is you're doing this for the community, truly. And we view this as a ministry. It's a ministry of healing. And if that appeals to you, which I know to many folks it does, this is the place for you.
Covenant says it needs people with varying degrees of educational experience, especially in entry-level positions, including non-licensed workers and those with no clinical background.
It is a great time to get into healthcare.
Elizabeth Fitz, KLBK News.
As the situation